Hello everyone, my name is Benson Kiragu, a public health specialist and a pharmacist with over 10 years of experience in community health, research coordination and implementation of non-communicable disease programs. For the past 10 years, I have worked with the academic model providing access to healthcare Ampath. In my role, I have supervised more than 300 community health promoters, coordinated community-based research activities, supported mobile clinics, strengthened referral and linkage system, and contributed to screening of over 5,000 community members for diabetes, hypertension, and mental health. This experience have strengthened my skills in program management, stakeholder engagement, capacity building, and improving access to quality healthcare. I am passionate about using evidence-based approaches to improve health outcomes, and I look forward to contributing this further in my next step. My primary role at Ampath has been on non-communicable diseases, particularly diabetes, hypertension, and mental health. I supervised over 300 community health promoters by providing mentorship, capacity building, and ensuring quality service delivery. I also coordinated community-based research activities and supported mobile clinics that brought healthcare service closer to underserved communities. One of the key responsibility I was focusing on was strengthening referral and linkage system to ensure that community members diagnosed with health condition were successfully connected to healthcare facilities for treatment and follow-up. I also contributed to screening more than 5,000 community members for diabetes, hypertension, and mental health, and to promote early diagnosis and improving access to care. Throughout my career, I have worked closely with the government, health departments, healthcare workers, community leaders, and development partners to implement evidence-based programs. This experience has strengthened my skills in project management, stakeholder engagement, data-driven decision making, team leadership, and monitoring program performance. I enjoy working with multidisciplinary teams and communities to develop sustainable health solution. Over the next 5 years, I would like to see myself leading nationally impactful public health research focused on identifying and addressing the barriers that prevent people from accessing quality health care, specifically for non-communicable diseases, particularly diabetes, hypertension, and mental health. My goal is to generate evidence that inform policies, strengthen system to ensure that healthcare services are accessible, quality, and inclusive, especially for vulnerable and underserved population, including people living with disability, those in rural communities, individual facing social economic challenges. I also hope to work closely with government agencies, research institutions, healthcare providers, and community organizations to translate research findings into practical intervention that improve health outcomes. Ultimately, I want my work to contribute to reducing health disparities and ensure that everyone, regardless of the background or circumstances, has access to quality care for non-communicable diseases. One biggest challenge I faced while implementing the Big Pig program was gaining community acceptance for screening for diabetes, hypertension, and mental health. Many community members feared being diagnosed because they worried about the cost of lifelong treatment that come with the cost after diagnosis. Other trusted traditional healers more than the healthcare facilities. Mental health was particularly difficult because many believed it was caused by witchcraft, curses, or bad omens, making people reluctant to be screened. So, to address this, I focused on building trust rather than simply increasing screening activities. I brought together healthcare providers, community health promoters, church leaders, local government officials, and organization training to improve the understanding of these conditions. We also held a community dialogue meetings where people could ask questions and discuss their concern openly. These trusted local leaders became champions for the program and helped display myths and misconceptions. As a result, community acceptance improved significantly. We successfully implemented more than 30 mobile clinics, screened over 5,000 community members for diabetes, hypertension, and mental health, and organized more than 10 community dialogue day forums that reached over 7,000 people. This experience taught me that effective public health leadership is about listening to communities, building partnership, and creating trust before expecting behavior change. And this clearly shows that let the solution come from the beneficiary rather than just bringing the solution to them. So thank you so much.